Ptosis surgery is a type of eyelid surgery that involves the center muscle in the eyelid. So ptosis repair can be done when you're doing eyelid surgery. It can even be done when you're doing blepharoplasty, which is a cosmetic procedure where you're removing skin and fatty tissue and a little muscle. There's a separate muscle that involves ptosis repair. Ptosis is basically congenital, meaning that you're born with it, or you develop it, it's acquired later in life. When it's congenital, you have a lot of fatty tissue intertwined like a zipper with muscular tissue and fatty tissue, and it's very weak. When it's acquired, you have a healthy muscle, but the muscle has pulled away from the cartilage plate or the backbone of the eyelid. So you advance that muscle onto the cartilage plate and it raises the eyelid for ptosis repair. Ptosis is a common symptom that we see with several different diseases. You can have something called blepharospasm, where you twitch and you close your eyelids a lot and develop ptosis from that. You can have a weakness of your eyebrow, or you could have Bell's palsy, and that could cause you to have ptosis. You could have a thyroid disorder, and that could cause you to have ptosis. Trauma can cause someone to have swelling and have ptosis. We even see ptosis after other surgical procedures. Like for instance, if a person has cataract surgery and they have a weakness of their eyelid muscle, they're predisposed to developing ptosis later in life. So by having the swelling of the cataract surgery, they'll get ptosis pretty soon, within a month after their cataract surgery. So ptosis usually is not related to other systemic conditions, but it certainly can be. So another reason it's very important to see somebody experienced in all the different varieties of ptosis and how to repair. If you develop ptosis, which is a droopiness of the eyelid, if it's caused from something like trauma where you have swelling, or you have a Bell's seventh nerve palsy and the palsy gets better, then your ptosis will also improve as your swelling goes down and as your nerve recovers. Most people with acquired ptosis or even congenital ptosis, the ptosis will either stay the same or get worse, but it will not improve unless you have a surgical procedure. There is a medicine available now that you can put in as an eye drop, and that will temporarily raise your eyelid, and lots of people will use that for a picture that don't want to have surgery, but they realize it's only going to last for 2, 3, maybe 4 hours. Please make sure to subscribe. Ptosis is repaired permanently by a surgical procedure to tighten the muscle to allow it to be in a higher position. Sometimes what we do is we give a medicine that will stimulate that muscle to contract so that a person can get a sneak preview, if you will, of how it will look. But if someone wants a permanent repair, it requires surgery for their ptosis to be alleviated. The risk of ptosis surgery in experienced hands are very minimal. The national average for a secondary adjustment is about 15%. In my practice, it's about 5 to 8%. And what that means is when a person heals, the muscle might be a little stronger, might be a little weaker than anticipated, and as it settles, you might need to make a minor adjustment. The way that's done is to unzipper the same incision that you made and either loosen or tighten a stitch to either drop down or raise the eyelid a little bit, and that's called an enhancement or revision of ptosis. Ptosis surgery is not painful to repair. We have numbing drops and numbing solutions that we can inject just below the skin so that you do not feel the procedure. The good part about ptosis surgery is you can even have it done while you're awake and we can adjust it and talk to you and have you look up and down at a Q-tip as you move your eyelid upward and downward to measure the strength of the muscle. The recovery from ptosis surgery depends if you're having other eyelid surgery with the ptosis surgery or the ptosis surgery by itself. If you're having the ptosis surgery by itself, it's a pretty quick recovery, like 4 to 7 days. If you're having it with blepharoplasty, some skin and muscle removal, or having to have an adjustment of an eyelash position, then the recovery is a little longer, more like 7 to 10 days. And usually we wait till the swelling has completely resolved, about 2 to 3, maybe even 6 weeks before we do any enhancement if that's needed. And keep in mind, the percentage of enhancement that is needed is 10% or less. So it's very unusual to need an enhancement, but it is something to be aware of. Ptosis surgery is a permanent procedure as long as the muscle is tightened and the eyebrow structure is stable. What can happen is if someone has the eyelid ptosis repair and then over time their eyebrow sinks down a little bit, then they will get a little more ptosis because all of the tissues around the eye are drooping some. But the eyelid repair is permanent. Ptosis surgery costs about $4,000 to $7,000 because it's a little more involved than what a blepharoplasty would be. You're removing skin and muscle, but you're getting down to a very specific layer that causes the eyelid to droop, and you have to be very skilled at tightening that muscle because the way it affects the dynamics of the eyelid closure.